All right. Hello, welcome everyone. Today we'll be looking at how to, look at the interactions between our body and the SARS-CoV-2 infection or COVID-19 disease. I'm joined with my good friend Earl Tiu. He's a doctor, and he'll be commenting upon my findings. Right. So again, this is not to be taken as medical advice. Just consider this as two good friends talking about how the body would respond, or some anecdotes on how the body would respond if there's like a SARS-CoV-2 infection. Right? So let's begin. Ganito lang siya. I found the data set in Kaggle from Sao Paulo, Brazil, and this from particular hospital. And may samples siya from COVID-19 positive patients, and of course they've also did other tests as well. And they've gathered it to one giant data set. So we have 5,000 plus total samples with 558 positive results, positive COVID-19 results, and 111 plus other variables. And what we have here is ito yung variables natin. And as you can see, this is just a subset of it. You'll have patient age, you'll have the SARS-CoV-2 PCR, by the way, exam results. You'll have information if the patient was admitted to the hospital. And of course, you'll have these CBC or blood tests. And then you also have these hosts of antibody tests, like for respiratory, syncytial virus, influenza, etc., etc., and others. No? So basically, you have a lot of variables, but what I found is there's a lot of empty fields, really. So we only use the blood chemistry, blood test variables. That's your hemoglobin, platelets, etc. Moving on, so ito na lang natira. These are all variables that we have, like hematocrit, hemoglobin, platelets, all the way down to protein C reactiva. So,
and then hemoglobin is the one that carries the oxygen. It's what binds to the oxygen molecule. It makes your from the oxygenated to the oxygenated blood. Platelets are what are like. These are what makes up your blood clot. So when you have a wound and then you start to scab, the platelets are the one that gets trapped in the fibrin matrix and makes up your blood. Makes your clot. The mean platelet volume is the average platelet amount, I think, in your blood. Usually, I don't really see this in the CBC. RBC is the amount of red blood cells.
yun lang alam ko. Yeah.
And neutrophils, these are your a type of WBC. Mainly, it mainly eats it can take as your macrophages, or it eats the bacteria. Lymphocytes can be your T lymphocytes, can be for part of your autoimmune system. B are for your innate, T is for your active immune system.
All right. So I also defined the severity variable, and what in the data set there's like negative cases as well, of course, and there's some 500 plus positives. And if you're admitted to regular ward and semi-ICU or admitted to ICU, these are also positive patients. So at the beginning of the study, I also tried to differentiate how these samples or patients differ, but the low samples dissuaded me from continuing any further. So anyway, we're just going to relate the negative and the positive. Okay, so just some sample distributions. So as Dr. Earl was saying a while ago, there's this hemoglobin count. It's normally distributed, and in the blue ones are the positive or negative ones. So negative sa PCR tests, positive yung nag-positive sila, and positive dash all means even if nandun sila sa ICU, basta lahat ng nag-positive. So platelets, there seems to be this difference, yeah, right? So if you, from this graph, the mean of the positive COVID-19 patients you have a lower platelet count on average. So there might be something there. That's why we will do a little bit of modeling later. Over the side below, we have the red blood cells and the leukocytes, right? So these are your red blood cells and white blood cells. First, we do feature selection using variance inflation factor. Then we do logistic regression with 10 cross-fold validation, and then we're predicting positive versus negative so that we can know the associations between those variables to our SARS-CoV-2 positive patients. I also tried other models like RBF-SVM, but they performed poorer than the model, linear model, so we just proceeded with this one. And Dr. Earl and I were talking about these, no? So we were talking about the differences between a data scientist's naming. So what I did was to make it easier for Dr. Earl is to make it more medical terms. So what we have here is it's quite decent results. Our OC-AUC is 0.81. The negative predictive value for the negative in the test is 0.872, positive predictive value is 0.643, specificity is 0.9, and sensitivity is 0.53. So these are not the best results. What I can get from this one is that it's having a little trouble in detecting those who are positive. But again, you're not trying to detect per se as a diagnostic test. We just wanted to see the associations ng variables natin to COVID-19. No? So, Dr. Earl, do you have like, a point of view over this?
So ang ano lang natin dito is so usually if it's a test but if you have a high specificity value but a low sensitivity value, usually you paired two tests that has the other test has the screening, so you can use screening tests have usually high sensitivity but can be low specificity, and then you pair it with a test with a high specificity but low sensitivity. In this case, since we are not treating this as a test but just an association, maybe we can just take these results as an anecdotal finding in our viewing for COVID-19.
These are the top coefficients for predicting positive SARS-CoV-2 results. And the higher the coefficient, even the positive direction, that means if you have a higher value there, that means you're more likely to be positive if you have a high value of, for example, urea. But in this case, it's not so high. It's not even above 1. So I'm not looking at that. What I'm looking at is yung ating eosinophils and leukocytes, which is, what this means is the higher the leukocytes or the eosinophils, the more likely you are for negativity or negative in SARS-CoV-2. So this assertion again is just for that hospital and this for this specific anecdotal study. First naman, the positive ones are playing around a bit lower than 0, right? More on the negative side of the number scale. Pero yung negative nating patients, they're closer to 0. So the difference here is quite subtle naman. So, ano naman yung eosinophils? I think you mentioned a while ago allergies.
Eosinophils, usually it's red in stains. That's why it's eosin. So, you usually think about this. They usually appear in allergies or in parasitic infections, or it could also be primary eosinophilia, but that one is rare.
This is the distribution for the leukocytes, positive versus negative. And this has been alluded to before a while ago, but seems that if you have a higher level of leukocytes, your higher level of leukocytes, you're likely to be negative. So yeah, the mean for this particular sample, it's a bit higher, right? I also ran an inferential test here, and yeah, there is a difference in means, right?
Yeah.
But siguro, can you describe to us what does it mean to have a high leukocyte or low leukocyte in your blood, doctor?
If you have a high leukocyte, it usually means you have an ongoing infection, but it depends on other characteristics. Maybe you have a cancer, but increase your total leukocyte, the immature leukocytes. So it depends on case to case basis. But more likely, you may have high an ongoing infection. But sometimes when from a high number of leukocytes and then an acute infection, then it turns to a chronic infection. You can have it can become leukopenia, which is the low degree of decrease in leukocytes.
Okay, right. In this case,
Or it can also be a sign of it can also be cancer in the blood. Maybe another disease could be a proliferation of RBC. So if you have the increased proliferation of the RBC, and you would have, and the bone marrow can be depressed in the WBC portion. So it would also show that. So it really a variable. If it doesn't really say the when you're only looking at a single variable in the blood chem, there's a lot of other things
now, right,
can contribute to the bigger picture than just looking at one part of the blood.
Right. For me, I think my discovery really here is, may some correlations, but less than prediction or less than stellar prediction results, particularly these two variables. But as Doc has said, things are more complicated than these two variables, right? So this may be how this is how I understand it. This may be how our body responds, but still it would vary widely, and of course from person to person. So of course other tests would have to be made really. So PCR tests are still number one. So that's what I got from Doc. And that sounds about good naman, no?
Yeah.
All right. So we're ending there. Thank you for joining me, Dr. Earl. Again, by the way, Earl has been my friend since way back. So we're comfortable speaking like this. No? So thank you, Earl. Thank you for your time. And see you later. See you guys later. And good night. Anywhere you are.